KARK4 and Fox 16. This is a special report. Here's Mitch McCoy.
Welcome into KARK4 and Fox 16. I am Mitch McCoy. I am very excited to bring in the Arkansas Department of Health today. The Arkansas Department of Health's number 2 in charge, Dr. Jennifer Dillaha. She is going to spend the next few minutes with us talking about COVID-19 and masks, and she's going to be answering your questions as well. Welcome into Studio B, your interactive studio here on KARK4 and Fox16.com. I'm Mitch McCoy. There's Dr. Jennifer Dillaha. Doctor, thanks for joining us today. I appreciate it.
Well, I'm glad to be here. Thank you for having me.
So over the next half hour or so, a little less than that, we're going to talk about masks and COVID-19. There's a lot of questions out there, and there's at times confusion. Can you kind of catch us up on some of the major developments that have happened this week related to masks?
Sure. The CDC came out with recommendations this week that people who are fully vaccinated do not need to wear masks when they're outdoors or indoors, and they don't need to continue with social distancing. So that's very good news.
That's what one would say we've been striving for throughout the pandemic.
It is. It's our chance to get back to a new normal.
What would you say is the next point in the pandemic? We know the CDC's advice is if you are vaccinated, you no longer have to wear a mask. When do you think people who are not vaccinated, unvaccinated, will be able to pull that mask down?
Well, it will depend on how well we are able to keep the spread of COVID-19 low in our communities. Let me say a little bit about what vaccinated means. The CDC is talking about people who are fully vaccinated, which means 2 weeks after a person has received their second dose of either Pfizer or Moderna vaccine, or they've received 1 dose of the Janssen vaccine and 2 weeks have passed. Those people would be counted as fully vaccinated and can resume their normal activities.
That is really good news, especially given the fact that, we've been in the middle of the pandemic now, it seems like for forever, 15 months or so. And so it just feels good. I'm sure it felt good to pull the mask off.
Oh, yes. And it's just perfect timing. We're getting ready to have a good summer. The number of cases in Arkansas is low. The spread is low. We do have some spread of variants of the COVID-19 virus that are a little bit concerning, but they are well covered by the current vaccines that we have available. So this is a good time for people to get fully vaccinated and then take that mask off and go about your daily life.
That's fantastic. Right ahead of the weekend, no doubt. I want to welcome folks in who are joining us right now across our digital platforms, KARK.com, Fox16.com. And if you have a question, feel free to leave it in the comment section below, and we can answer your questions. You can leave it right on the Facebook page, and we will add it into the comments queue. And we can do that over the next few minutes or so while we have Dr. Jennifer Dillaha from the Arkansas Department of Health answering questions here today. I want to bring in a couple of questions coming in now. Louise is asking, how long will the vaccine last? This is a pretty good question.
That is something that is still being studied. Of course, the vaccines are new and COVID-19 itself is new. Right now, we know that the protection lasts at least 6 months, but likely much longer. It could be that eventually we will need a booster dose, but we don't know that yet. There would be 2 reasons why we would need a booster dose: is if the immunity wanes, or if for some reason a new variant of the virus comes into our geographic area and begins to spread, and that variant is not well covered by the vaccines. We may need a booster dose to cover a new variant. But right now, the current variants are well covered by the current vaccines.
Well, and that's good news because there's a lot of questions coming in right now about the vaccine, and people are wondering, are they, when they're vaccinated, are they fully vaccinated? Are they not? Where can I go? Where can I not? I mean, this is still one of those viruses that the health officials are still learning about as we go.
Yes, we are learning about this illness, COVID-19, and it looks like it has some long-term effects on people, long-term heart, fatigue problems. Some people have cognitive problems. They have what they call COVID fog. They have difficulty thinking. So the disease itself has long-term effects that we would very much like to avoid by giving people pre-existing immunity to the virus by vaccination. The vaccines studies look really good. They've been proven to be safe and they work well. The COVID vaccines for the Pfizer and the Moderna vaccine and the Janssen vaccine all work well to prevent severe disease, hospitalizations, and death.
Well, we have a lot of questions coming in now. Again, if you're just joining us, I'm joined with Dr. Jennifer Dillaha. She has been a leader in Arkansas's coronavirus pandemic, an advisor to the Secretary of Health, even the governor in the middle of COVID-19. And we have a few minutes with her this afternoon. And she's answering some of your questions here on Facebook. So for folks that are joining us, feel free to leave your comment in the Facebook page that you're watching. And we have a question coming in now. Andrew says, it will be interesting to see whether the vaccines remain effective as variants continue to mutate. Doc, what are you seeing related to variations of the coronavirus and the vaccines?
Well, it's important to know that whenever someone gets infected with COVID-19 virus, they produce a number of variants themselves, and then they spread those variants. Now, most variants have no consequence. It doesn't change anything about how the virus spreads or the disease that it causes. But occasionally, the variants do cause problems. They can either be a variant that more easily and quickly spreads. That would be a variant of concern in that category. Sometimes they produce more severe disease, and that is the concern out of the variant out of the United Kingdom. We are tracking 5 different variants of concern in Arkansas. We've had over 100 cases of those variants in counties all over the state. So we know those variants are widespread, and we don't test everyone. So we believe that these variants are more common than just what our testing shows. Now, the variants, of course, spread more easily, but if we take steps to prevent their spread, then that keeps them from mutating further. And then it keeps people who have the illness from creating more variants by what multiplies in their body as they're infected. The best way to prevent the spread of variants is to get vaccinated so you can't get infected and have the variants multiply in your body and then spread them to other people.
And in terms of the masks, we have another question coming in, and this question's from Tiffany. Can small businesses still keep the mask in place? And I'm assuming she's talking about mask requirements.
Yes, they can still do that. And in some cases that would be important. You know, people who are fully vaccinated would be protected from getting the virus and from spreading it. If a workplace has low vaccination rates among their employees, they may wish to keep the mask requirement in place. That is a protection for their business, especially if that business operates in such a way where you have a crowded setting, such as manufacturing or an office setting or business, where if you had to have a lot of people quarantine, it would be detrimental to the business. They may very well decide to keep the mask and social distancing in place in order to protect their workers' jobs and also to protect their business.
Very interesting. I want to welcome folks in who are just joining us here across KARK.com, Fox16.com. We're also streaming live right now in Northwest Arkansas. For folks joining us, we're joined by Dr. Jennifer Dillaha. She's answering some of your COVID-19 and masks questions, and there's been a lot of new changes this week. Some of the changes have been a long time coming, and ahead of the weekend, there's a lot of people that want to get their questions answered. So I'm so thankful you've taken the time this afternoon. I do want to let people know, if you go to KARK.com/vote, we are asking the question, does the new CDC guidance encourage you to get a vaccine so you can go without a mask? You can go to our website now, KARK.com/vote, and you can take part in our poll question happening right now. I want to get to a couple of more questions coming in. Doc, we have a queue in line because everybody has a lot of questions for you. Jamie is asking this question here. Should kids continue to wear a mask? Those 11 and under, they cannot get the vaccine.
That is true. And so they would be in the category of unvaccinated persons, and they should continue to wear masks and social distance. I think it's encouraging that the vaccine manufacturers are working on vaccines for children under the age of 12. I'm hoping that they will be available by the end of the year, but until then, they could still spread COVID-19 in our communities and get it themselves. Children occasionally, not often, but occasionally can get very ill from COVID-19. So it's important to wear the mask, even though it's a very hard thing to do, I think, for children.
Well, and in a lot of cases, there's parents who are vaccinated. They want to be a good role model for their kid, and maybe they'll keep the mask on to be that role model.
I think that's an excellent idea. I think if everyone in the family is doing it, it's easier for the kids to do it.
We have a couple more questions coming in here, and this question is coming in from Doris. I know people who have been fully vaccinated and they caught it. Doc, I've heard this before. Is it possible for people who are vaccinated to get COVID-19 after vaccination?
Yes, it is. About 5 to 10% of the people who are fully vaccinated can still get illness, would be mild illness. It's very uncommon for it to be severe enough for someone to be hospitalized with the illness or have severe disease. Now, there are some people who have health conditions that weaken their immune system, either the health condition or the medications that they take. And those people may not respond as fully or as robustly to full vaccination as someone with a normal immune system. So those folks are still at risk. And for that reason, I encourage everyone who's not vaccinated to get vaccinated to help protect these people who have weakened immune systems. So people with weakened immune systems and fully vaccinated, they may wish to continue wearing masks and social distancing because they're in a more vulnerable situation than someone with a normal immune system.
Very interesting. And we're learning so much from you, so I really appreciate it. We have another question coming in right now, and this question is coming in from Catherine. Catherine is saying, I have had COVID-19. Do I need a vaccine?
Yes, I would encourage someone who has had COVID-19 in the past to go ahead and get fully vaccinated. The reason for this is that we have well-documented cases of people who have had COVID-19 and then gotten it again. The vaccine appears to be protective against getting it again. The other thing is, if they get vaccinated, it's possible that they can avoid getting infected with one of the variants that maybe was different than their first one, and they may not be as protected against the second variant.
Okay, which I'm happy to hear that, Doc, because I had COVID-19, got it 2 days before Christmas, and I got the J&J vaccine. So I'm happy to hear you say that.
Yes, yes, I think it will help you in the long run.
Okay, so that question coming in from Catherine today. And Doc, if you don't mind, I'm not going to pop this question in on the screen here. It's more of a comment. And I'm hoping maybe you can help address it. Let's set the record straight here, right? We have an opportunity to talk straight with the people. Paula says, we don't vaccinate children for pneumonia or hepatitis. She's suggesting don't give the shot, the vaccine to children. What's the difference between pneumonia, hepatitis, and then coronavirus? Why coronavirus for the vaccine?
First of all, hepatitis and pneumonia are things that we do vaccinate children for on a routine basis. Hepatitis B and hepatitis A are part of the CDC's recommended vaccinations for children, as well as the Prevnar vaccine, which protects against pneumonia. So I'm not really sure why this person thinks that we don't vaccinate against that. So what was the rest of the comment?
Well, you pretty much answered it, Doc. You pretty much answered it. And this is why I love doing this stuff, because there are, especially with social media, there's so many, comments out there, and you see a comment and you think, well, you're right. I mean, we don't. But then you have a medical professional like yourself. Correct me if I'm wrong. The second top doc of the state answering these questions, and that's why I'm so thankful that you're coming on today to help us set the record straight, help us inform people, so that way everybody can make their own rational decisions on vaccinating or not. So I really do thank you for helping us understand all that. Cynthia's bringing in a question now, going back to the variants. Is there a way to track variants in Arkansas by county?
Yes and no. I mean, we know what counties the cases are that we have sequenced to know the variant, and they're in close to 40 different counties in Arkansas. But just because we've identified it in one county and then not another doesn't mean it's not in that other county. So we know that the variants are widespread, and we're doing tests to see if we can find it. We're particularly looking for cases which are people who've been fully vaccinated to see if they got a variant that maybe the vaccine didn't protect against. We're also looking for cases, where, these variants spread much more easily and quickly. So we're looking for clusters of cases that might indicate a variant, or someone who has traveled internationally that might be bringing a variant here, or from other parts of the US where some of these variants are very prevalent. So we try to track it, but it's not easy to identify all of the cases that are caused by these variants, because we don't sequence these virus specimens from every single case.
Okay. And variants pop up new. How often do new variants pop up on average?
Every time someone gets infected, the virus multiplies itself. And when it multiplies itself, it doesn't do it in a perfect way. It makes mistakes as it copies its genetic material and creates a variant. So when someone passes it on to someone else, they actually have multiple variants in their body. And those variants usually have no consequence, but occasionally the mutation in one of those viruses results in some change in the virus. It can spread more easily, or it can cause more severe disease. And when those get recognized, then those are tracked. We call those variants of concern. And there's about 5 of them we're tracking in Arkansas right now.
Okay. Another question coming in right here, and this is coming in on our Facebook page. And quite interesting. We may have talked about this yesterday during our interview, and I was talking with one of my friends on the way to work today, and she brought this question up, and it is interesting, and it's really, I think, an honor code system that's in place. Maybe you have a better explanation. Judy says, if you can go without wearing a mask if you have both vaccines in public, how do you know that person was vaccinated? And I thought about this last night. And I thought about what you and I were talking about. I went to Sam's Club last night and I thought, well, I'm vaccinated. I don't need to wear a mask. But then I saw a lot of people without a mask and I started questioning, I'm like, are they actually vaccinated?
There's no way to know. And that's why I think that we need to be very cautious and stay home if we're sick, because those people who are choosing not to wear masks, even though they're not fully vaccinated, could put themselves at risk for getting the illness while they're out and about or spreading the illness. They may have the virus and be spreading it and be asymptomatic, they just don't develop symptoms. Or a lot of times people can spread it 1 or 2 days before they actually develop symptoms. So they might be pre-symptomatic and spread it.
Right.
And that is going to be a problem for us in Arkansas, because as I mentioned, every time someone gets infected, they're creating new variants. And the way to not create new variants is to not get infected and keep the spread very low. So I think we should all encourage one another to make sure that we get vaccinated and protect not only ourselves, but our communities, our workplace, our schools, our family, and the people we love.
Last question. I know we're wrapping up and you're going to have to go. In my mind, I'm thinking, I'm vaccinated. If I'm sitting at a restaurant and the table next to me, somebody is coughing or hackling, and I'm not wearing my mask, is there any concern for me at that point if I'm vaccinated, I'm not wearing a mask, the person next to me hackling may or may not be vaccinated?
Well, the concern for you would not be so much from COVID-19, but it's whatever else they might have.
Okay.
So we encourage people who are sick to stay home, even if they know they don't have COVID-19.
Right.
But I think it is important for people to have confidence in the vaccine. I think they work very well. People who have been vaccinated, as we mentioned earlier, can get mild disease, but that's very uncommon. And people can trust that they can be protected from getting COVID-19 if they are fully vaccinated.
Is that the next game plan? I mean, now that we've reached a point where you have people who are vaccinated, they no longer have to wear a mask. Is the next goal for the Department of Health, is the next goal to build trust with the vaccine? I know that's been happening, but is the attention focusing towards that?
Oh, yes. I think for people to have confidence in the vaccine is important for them if they are going to choose to get vaccinated. Making an informed decision about the vaccine is important. There's so much misinformation out there available on TikTok and Instagram and whatever that it's hard for people to sort through. A lot of the information that's actually wrong about the vaccine sounds very believable if you don't have a background in science or medicine. Mm-hmm. So I'm encouraging people to try to keep an open mind about being vaccinated, and then talk to someone they trust, not just someone who they can trust to be honest, but someone who has expertise. You can trust their expertise in the vaccines to help them sort through the information so that they can make an informed decision.
All right, Dr. Jennifer Dillaha from the Arkansas Department of Health. Doc, thank you so much for your time this afternoon and helping us clear up a lot of questions, helping us get us through the pandemic. We really appreciate your time. Thank you.
Well, thank you for having me.
All right, take care. See you again. Thanks for watching, everyone. Have a good rest of your afternoon.